Hello, everybody, and welcome to Doc Talk with Monument Health. My name is Mark Houston, and this is a big one right now. I never thought, well, of course I thought we'd get this far. I'm cocky that way, I guess. We're at our 100th episode right now, and I want to welcome Dr. Deanna Lassegard back, who I figured has been on 4% of these right now that we've done. So thank you for coming in to do this.
You're welcome. I'm happy to be here, especially for the big anniversary
I know,
one.
this is such a big deal. Most podcasts don't make it past 10 or 12 episodes in a lot of instances, which is, people will go out and give it a try and realize it's a lot of work. And what's been so fun about this for me is getting to meet so many of you from Monument Health, and you've all been just the best people to talk to. It must be fun to work at a place that you feel that comfort and just the genuineness of the doctors and nurses and stuff.
Absolutely. It's awesome that we get the opportunity that we can share with the public some of our knowledge that we have, because almost everyone who goes into medicine is really passionate about what their specialty is. They have spent a considerable amount of time in school and learning about it. And we're all kind of nerdy and we really love what we do. And it's fun to talk about it with the general public. And so this is a great avenue to be able to spread good healthcare information to the community.
Yeah, absolutely. And over the 100 episodes that we've done right now, we will get people that listen. I've noticed on social media when you guys post this up on the Monument Health stuff, there's questions that are asked sometimes on the topics that we cover. There's lots of my favorite ones to see are, oh, I absolutely love this doctor. This is my favorite. I love going to see him or her or whoever I'm going to. And then we started to get questions about halfway into this that were emailed to us. And so I thought, 100th episode, let's take some of these questions we've gotten from people that listen and have somebody like you come in and answer these. So you're in the spotlight right now. You came in and said, yep, I can do this. So I'm excited to get some of these answers.
Emergency medicine's good at being in the hot seat.
It
fits.
I never even put that together, but yes.
Either family medicine or emergency medicine, kind of one of those well-rounded specialty type of things where we do kind of a little bit of everything.
You do, yes, for sure. Okay, well, let's start out with the first one that we have on the list here. A lot of people, obviously, turn to the internet to get medical information, right? Because as soon as you get a cough, you type in the symptoms, next thing you know, you think you've got super cancer, right? And everybody panics about that. So as a doctor, emergency room or just family medicine in general, are there sources online that you feel are better to search than others?
Absolutely. Okay. There's definitely a hierarchy of how trusted the information is. Anything that comes from a well-reputed large healthcare system like WebMD or Kaiser Permanente or Monument Health or Cleveland Clinic, those types of big institutions where they have physicians weighing in on that, and they have a PR and marketing team who are helping to make sure that the message is drafted so that the lay people understand it. Those types of websites are going to have much better information than just a random Google search or a blogger who wants to talk about the tinctures that she's selling this week. There's a lot of information out there. Healthcare and wellness are really important, but they're also really a money-making industry as well. And so you have to make sure that you're getting your information from a source that's non-biased, that has a team behind it that's vetting the things that this person is saying. And so large healthcare institutions, CDC websites, WebMD actually is quite good. They have doctors that are looking at that information and making sure that it's appropriate, and a team making sure that we aren't throwing out all this doctor jargon and using these huge words like subdural hematomas and pneumothoraces and, confusing the general public, because when you take that information in, it also needs to be understandable. And so we have to make sure that, as a doctor, I'm not throwing out too many doctor words and confusing people. So having a good PR team that's making sure that it's timely and written at a level that people will understand is also really important. So the big institutions are trustable.
Okay.
That's where you should get your info. If you're going to start Googling, don't click on, Sarah Susie Q's medical advice. Right. Pick in the Google search lineup, pick one of the name brand institutions that you can trust.
And I think, too, when you're looking at those, they have to put it in such a way as to cover a lot of the details of what you think is wrong with you, right? Mm-hmm. So they will list some of the more scary aspects of it sometimes too, yes, that you got to really be careful of, right? Mm-hmm. To not go to, just go into full panic mode, I suppose, either.
But that's kind of one of the big things about emergency medicine is that, it can be all the way up to the really bad thing.
Sure.
And so they do include that because a cough can be from, a minor, the pollen is in the air, to this is lung cancer. Mm-hmm. And it really does run the gamut. And as a human species, we just kind of tend to go to that worst case scenario. And so when we Google search things, we do have to keep in mind that it is going to be the full gamut of anything that can be related to a cough or related to abdominal pain. A lot of the websites, though, are pretty good, like WebMD. If you just throw in abdominal pain, it'll kind of start to guide you to where in your abdomen does it hurt. What other symptoms kind of do you have, and help you kind of move down an algorithm that's a bit more helpful.
Okay.
But yeah, it's always going to be from the completely benign to the worst case scenario that it possibly could be. Because in reality, that's how all symptoms are, is they can start off mild and it can be something severe. So
do you, as a doctor, do you recommend, or do you think it's okay for people to first get online to check information like this? Or would you rather they made the appointment with their doctor first?
I guess for me in the emergency department, I would like to know that they have done some Googling.
Okay.
Because then we can address what those concerns are. If I don't know that they read a Google article that says that they might have pancreas cancer because they coughed once,
right,
I'm not going to address pancreas cancer, mm-hmm, because it's way less likely to be the case of what's going on. And then they may go home with this question of, well, she never said anything about cancer.
Yeah.
And so it is nice to know. I think it's fine that people do it, but it's really helpful if the doctor knows, and the doctor knows what the concerns are that the patient has. I've had this cough. I looked online trying to decide what to do, and then it said possibly cancer. Mm-hmm. And then we can address that. We can put that to rest, and then they have that peace of mind. And so sometimes people won't come straight out and say what it is that's the most worrisome thing, because they want to come in and get the doctor's opinion. I have a cough. I have a belly pain. What do you think? But in the back of their mind, they're worried about something in specific. And it's really helpful if you tell your doctor that. Because then they can address that specifically, and then they can alleviate your anxiety. It doesn't help much really if you go home and Google after you've been in the ER, because then there's no way to address that.
Yeah, exactly. So okay, that's really good advice, mm-hmm, actually. Okay, let's go to another question that was sent in. I thought this one was kind of interesting because I don't think a lot of us, as we go down our health journeys or we read our blogs that we probably shouldn't be reading, you'll see a lot of different people that recommend lots of different things to take that aren't necessarily, prescription medication.
Yeah.
We're specifically kind of here in the vitamin aisle of your
vitamins and supplements,
right,
and yeah.
Can you overdose or overuse vitamins? Is that possible?
Yes, you can.
Really?
There are certain vitamins that are water soluble and certain vitamins that are fat soluble. And
now, what does that mean?
So that means that vitamin dissolves in either your blood and liquids in your body or is saved in your fat cells. The ones that are saved in your fat cells, we don't have a really good mechanism of metabolizing and getting rid of them quickly. So the fat soluble vitamins are going to be vitamin A, D, E, and K. And so those, you can get a little bit too much of those. The other ones, like vitamin C and vitamin B, most of those are water soluble, and your kidneys will filter out what they don't need, and it's not usually a problem.
Okay.
But there are ones that you can overdose on and that can cause problems. And so if you're going to start a supplementation regimen, if you feel like, your diet might not be the best or you might be missing something, it's best to talk about that with your doctor or with the pharmacist, making sure that it's not going to interact with any medications that you're already on or supplements that you're already on, or that another supplement doesn't have another one of the exact same vitamins or supplements in it, kind of an overlap, a multivitamin and something special. And so pharmacists are going to be the masters of all of the, chemistry behind that and what medications are safe, what supplements are safe together, but your doctor as well.
So big shout out to the pharmacists for you.
Yeah,
right there.
Absolutely. 100%. We turn to them very frequently for, hey, is this safe? Can we do this? That is their lane.
Yeah.
And they are the masters of that. So absolutely, any pharmacy that's selling supplements, you can consult with a pharmacist and you can ask them about the different supplements and what you should be taking, what symptoms you're looking to relieve or what you're trying to boost in your system. And so making those decisions not in a vacuum by yourself, but including your healthcare team and including your doctor, letting them, of course, know what you're taking and then discussing it with a pharmacist based on what your goals are and what your concerns are.
Yeah. Do you have vitamins that you, as a doctor, do recommend? Because I think a lot of them, I think we go too far down the path sometimes of thinking, well, a multivitamin will fix everything that's wrong with me. Do you have, have you ever found vitamins or in anything you've ever researched that you're thinking, you know what, these are beneficial and these may be what people should take?
Well, we all take vitamins at my house, but we have we're picky dieters.
Yeah.
My kids, they want mac and cheese and chicken nugs and that's it. And
now.
they're not eating kale, and they're not eating their broccoli and their carrots and all of their different minerals and electrolytes. So they get a daily Flintstones chewable vitamin. And that just kind of helps supplement what they're not taking in because they're little and they're difficult and I have to pick what fights I'm going to fight that day. And sometimes the kale broccoli fight is just not the fight that I'm willing to choose. And then for menstruating women, usually something that has an iron supplement is important because they lose blood every month and they tend to be a bit more on the anemic side. And so something with iron to help fortify making red blood cells is important. And then as we age, of course, there are some other things that we can do that we can supplement vitamin-wise that are helpful. And so a routine kind of generic multivitamin is usually never going to be a problem unless you have some specific medical problems or medicines that you're on.
But still talk to your doctor or your pharmacist
absolutely,
for sure.
Anytime you're going to add anything to your medication regimen, absolutely it should be discussed. Yeah.
What sort of wellness tests should you have on a regular basis? Aside from just seeing your doctor once a year, is there anything else generally you throw in there, or is that pretty much covered?
It is covered. If you see a primary care doctor or you have a healthcare team, they are going to be following the recommendations from the healthcare societies on what type of screening you should have done. So women over the age of 40 should be having mammograms, those types of things. Men over the age of 50 to 60 should be having, some sort of prostate screening, whatever choice that is. And so the primary care team are going to be the ones who absolutely know that inside out, know exactly what the recommendations from the cancer societies are, from the wellness societies, and be able to kind of guide that for you. If you're a young, healthy person who doesn't see a doctor, often healthcare systems will have like wellness labs where you can go and get like a panel of your wellness labs occasionally done. And that's fine, but then you're kind of flying on your own. You don't really have anyone to help you interpret that data as to, is this normal? Is this abnormal? What does this mean for me? Another really important thing about screening and wellness labs are that we don't just look at one of them. It's more about trends over time. And so having a relationship with a primary care doctor and having routine visits and physicals to where we can see over time, oh, these are what your labs always are. Yikes, that's a change. Like, it's not a huge change. It's not totally out of the realm of normal, but geez, it's a big change for you. Those types of things can be picked up really easily when you have continuity.
Okay. So when you have all these tests done, one feature that I think people should use a lot more, even if you're not super tech savvy, is the app that Monument has, which is called MyChart.
Oh, yes.
It's a wonderful app that keeps track of everything for you when you see your doctor. The issue that this person wrote in as a question for is, you see these abbreviations on these test results, right?
It's all that doctor jargon.
It is. There's a lot of it right there. Some of it's pretty obvious. We know what BMI is at this point. I think we know what BP is, HR,
blood pressure, heart rate.
Those are some easy ones. But then you get down this list of like TG. which would be the triglycerides.
Triglycerides, yep. Yeah. So that's going to be cholesterol.
Is that what that is?
Cholesterol, yep.
Okay. Some other ones on these lists, I'll just quiz you, see how many maybe you know. Like WBC.
White blood cell count.
Okay.
So that is part of a CBC, which is a complete blood count. So a CBC is a standard test that a lot of patients get, a complete blood count. It's looking at the amount of white blood cells, the WBCs, the amount of hemoglobin and hematocrit. So that's the concentration of your red blood cells. And so that's hemoglobin, HGB, hematocrit, HCT, platelet count, which is PLT, and so there's, yes, it is, which is why it's so important to have a primary care doctor that you can talk about these things with, because otherwise you're just kind of flying in the night. What are all these?
You do.
What do all these letters mean?
And then you start to Google, and then the anxiety kicks in sometimes down the road.
So CBC is kind of a big one that everybody gets as a screening, and then either a CMP or a BMP, which is a complete metabolic panel or a basic metabolic panel. That's going to be looking at kidney function, which unfortunately it's not just abbreviated KID for kidney. No,
of course not.
It's creatinine and BUN, which is the urea natric peptide, and so
I had those on here too.
Yes,
that's great.
Yeah. So those are going to be your kidney function, and then they've got all of the electrolytes, and those are abbreviated as the periodic table would abbreviate them: magnesium, Mg, potassium, K, those types of things. And a CMP, the more complete metabolic panel, will often have liver function testing. And again, it's not as simple as just liver plus or liver minus.
Right. There's ALT,
AST, transaminases, all the different liver enzymes, bilirubin. And so it's not as simple as just thumbs up liver, thumbs down liver,
Maybe we need to put that in the chart anymore. Just
no thumbs
smiley
up, thumbs face, unsmiley face, and a picture of the organ next to it. That might be helpful. But it is not meant to be information that you use on your own. We want patients to be empowered to know what their labs are. So if they're vacationing or they're out of the area and they go see another doctor somewhere, they can pull up their chart and say, these are what my labs usually are. And then there's that continuity of having that information, and information is power.
Right.
You may not understand every little detail of the information that you have in that lab test, but you have that information and you can take it to your doctor, you can take it to your subspecialist, you can take it if you're in California and fall down and twist your ankle and you're in an ER over there. You have access to all of your health information, and whoever's there guiding you through that process can use that information. And so that's why my chart is so important. It saves the day all the time in the emergency department. People don't remember what medications they're on or what doctor they see. And if they're not in our healthcare system, often they'll have some sort of my chart that they can pull up on their phone, and I can see all of the data that they've had from previous doctor visits, who they see, what their medical diagnoses are, what medicines they're on, and what their baseline labs look like. And so that is fantastic.
Yeah,
it is a super helpful tool.
Yeah, so much easier.
So just having these labs on your own and trying to kind of parse out what do these little acronyms mean, is not all that helpful in that context. Right. But having that information is so powerful for someone's healthcare. And so being able to have it, and if you have questions on it, the really nice thing about my chart is you can send a little message.
Yes, exactly. It's
and you can just say, hey, I have a question. This HCT is down a little bit from the last time. Is that something I should worry about? And what does that mean for my healthcare? And then either the nurse or the doctor will respond back to you in a timely fashion. And it's just, there's so much power in being able to have access to that information. Even if you don't understand every little nuance of it, it's just having it is very powerful and very helpful for healthcare.
And we were joking about the thumbs up, thumbs down, but if you notice on the My Chart there, with all of these acronyms, it is a yellow, green, yellow line. Yep. So you always want everything to be right in the green, generally, which means things are fine. Right?
All normals. But those normals are mostly based on just a generic, healthy, younger population. And so some people will have a little bit of abnormal labs, and that's normal for them. And that's why it's so important that we have that continuity, that we don't just take one lab result as like the piece of information that it is. It is a building block in a much bigger rainbow of all the information that we have about somebody's healthcare, in looking at, have there been changes, or has it always kind of been this way? And that's just you as the unique creature that you are.
Right. And your labs can be, it can be because you're nervous about having a lab done. I had blood drawn one time.
More your vital signs.
Maybe that's it. Maybe that's what it was. Yeah,
more your vital signs. Your labs don't really change that dynamically that quickly with
maybe
stress
I should
levels.
just not be so nervous about going in there all the time. That'd probably be helpful.
Nobody likes getting poked with a needle.
I know. That's
but
just
that
it.
does bring up a good point about vital signs and how they do change when you're in a stressful situation. Oftentimes going to the doctor is scary for people, and there is a well-documented phenomenon called white coat hypertension, meaning your doctor stresses you out and now your blood pressure's high. And now you're diagnosed with high blood pressure because you're stressed out at your doctor's office. And so we do understand that. And I always tell people when they come to the ER, like, yeah, your blood pressure's high right now, but you're in the ER.
Yeah.
I kind of expect that.
Right.
You know, it makes people nervous. Nobody comes here because they're having a great day. And we'll recheck it and we'll watch it. We'll make sure that those things kind of stabilize. And once they settle down a little bit and realize we're not coming at them with the big needles, that blood pressure just comes down a bit. But that's another thing that ends up in my chart. You know, you've got your vital signs that are in there. And so, you know, a patient can see, geez, there's been a big change over the past few months. My blood pressure's gone up significantly where it didn't used to be that high. It just, that kind of information and having it at your fingertips is so helpful. And everyone should have a My Chart.
Yes, you should.
Don't say no to the My Chart. Sign up for the My Chart. Have that access.
It can be, if used the right way, it can be such a relief in so many instances too.
Yes.
And that kind of leads into the next question we got from somebody, which is a very, very broad general question. But maybe you can just narrow it down to where they can start the process. And the question was, how can I manage my anxiety?
Oh,
right? Yeah.
that's a good one.
Yeah, that's a huge, and it's kind of what we're talking about a little bit too. But if somebody feels that way, where did they start?
I would say with your primary care doctor.
Okay.
And hopefully you've got a good relationship with your primary care doctor that's maybe not an anxiety-provoking visit. Going to go talk to your doctor whom you already know, who already knows your family, and hopefully in most cases, and you can discuss with them, you know, the symptoms that you're having. And then they can kind of guide you to the next way possible. Like how bad is this anxiety? Is it interfering with your daily life to where you can't do your normal activities appropriately, where you're not functioning, where you're not thriving, where you're not enjoying life? Do we need to do something like, you know, counseling, or do we need to start medications? How bad is it? Primary care is going to be the best place to go for that, unless you're having a crisis. You know, at a crisis point, thinking of hurting yourself or hurting others, that's definitely an emergency department visit when we're at a crisis point.
Excellent. Yeah, that is a great place. Okay, that was well answered, I think, for as broad as that question was. Sure.
It is, and that's what makes healthcare information and seeking healthcare tough, because it really is so broad and it's so individualized that you can't make an answer that answers everyone's question. You know, there are so many different scenarios, and having a primary care doc and having an ER that you can go to when you have concerns that are of the emergent nature, when you have concerns that are of a less emergent nature, that sounding board, that person that you touch base with that can help guide you through the very, very complex healthcare system,
right,
and get you to the right people for the right thing.
All right, perfect. Next question. What lifestyle changes do you believe have the most significant impact on long-term health?
Oh, yes. Smoking.
Okay.
Stop smoking. If you smoke, stop smoking. Number one, and that's going to be number one. Number two is probably going to be any other vices that you have that are a little overboard. You know, too much alcohol consumption, too much food consumption. You know, those types of things, processed food consumption, way too many calories.
Yes.
I would say, so like smoking is going to be number one. Absolutely. That brings no benefit to your health whatsoever. It affects your health poorly in every way possible.
Every category. Yes.
Everything is associated with smoking at some point. It seems like it is terrible for your health. The next, kind of looking at what are your vices that you may be a little overdoing on, like alcohol or calories or things like that. I'd say number three is probably just general activity, just getting up and doing things. We have become, as a society and as a race of humans, just way more sedentary over time. Yeah. We used to be, hunter-gatherer farmers and working all day long, and now most of us us have sedentary jobs where we're sitting at a desk and we're not getting up and getting around as much. Physical activity is going to improve your health in many, many ways, reducing the risk of heart disease, reducing lung diseases, reducing so many different long-term health problems like diabetes, obesity, hypertension, all of those things that go into your overall health care and lead to other diseases down the road are going to be decreased by decreasing your overall weight and increasing your amount of physical activity.
And it's not like you got to jump into CrossFit. That's not what we're talking about here either,
that's
right?
pretty intense. But just, like the little Apple Watches that say it's time for you to stand up.
Right. It's
just
a silly
get up
thing,
and walk
but
around. But when you're busy and you're working hard, you don't think about, geez, I've been sitting here for 4 hours and I haven't gotten up and moved and I haven't gotten my heart rate increased. Simple things like, walking outside, taking a break from work and going for a 10, 15-minute walk around the block, when it's nice out. Those types of things will make a difference on your overall health care.
Okay. I absolutely love this next question because this has to be the hardest one for you as a doctor. When people come in and they have symptoms that just don't quite align with your common medical knowledge, right? What do you do in that instance? I mean, you're an ER doctor, so you can see stuff that come in where you're like, wait a minute, I've never seen this before.
Oh, yeah.
Right?
No matter how long you've been doing it, there's
something new.
And people don't read the medical textbooks. Your appendix has not read the surgical textbook on how it is supposed to present itself as an appendicitis.
Yeah.
And so it really can vary on how it presents. I always say, the body parts don't read the textbooks. They don't know how they're exactly supposed to respond. We're all different. And so the symptoms that people can have can range, wildly. When someone comes in, we'll stick with the appendix with right lower quadrant pain. Everyone first thinks, appendicitis, but you can still have appendicitis and have pain elsewhere. And so my job as an ER doctor is to kind of take all of the symptoms all together and what of them are worrisome. We've got a fever, you've got a high heart rate, you're in severe pain. Those things are all really worrisome. And then we come up with what's called a differential diagnosis. What could this be? Your belly pain down here and you've got, a fever and you've got, tenderness. This could be appendicitis. It could be colitis. It could be the stomach flu. It could be that you ate something bad. This is what the doctor is thinking. So that's all going into my differential diagnosis. Then I start doing lab work to help confirm and deny some of my initial thoughts about, could this be appendicitis? Could this be something else? We may add some imaging like a CT scan or x-rays to kind of help narrow down what this could be. So we start with a really broad list of the things that it could be. And then as we start getting tests that either confirm that or deny that diagnosis, that fit or don't fit, then we can start narrowing it down. Okay, we've got a CT scan and the appendix looks normal, so it's not appendicitis. And we just kind of keep narrowing it down until we find something that fits. But oftentimes, we may not find the exact answer in the emergency department, and then we refer people back to either their specialist or their primary care doctor. And so it is important that when they come and see somebody, especially when symptoms first start, it can be difficult to determine, is this something severe? Is this something not severe? And that's where all the testing and kind of talking and pushing on the bellies and the CT scans come in to try to figure out, where are we going with this?
Yeah.
We start with this vague, or kind of one symptom like belly pain, but it's so many different things that it could be. And so we start with a really broad differential diagnosis of what that could be. And then by testing and ruling things out, we kind of whittle it down to what are the most likely things that it could be. Sometimes that's something we can fix in the emergency department, like a urinary tract infection. Here's your antibiotic and it's fixed. And sometimes it's something that requires more testing either in the hospital or outside of the hospital to figure it out.
So when people come into the emergency room, it's not like you can say, we can fix it right here, right? I mean,
it depends.
It does depend. Some things, like you said, you can, but sometimes you've got to say, look, you're going to have a follow-up on this.
Yeah,
you're going to have to go somewhere else, right?
Most things from the emergency department are going to need follow-up. It's actually pretty rare that we completely fix the entire problem in an ER visit. Something simple like sutures, or a little sinus infection or a urinary tract infection. Those types of things we can usually fix within an ER visit. Throw a couple stitches in, you're good to go, man.
Yeah.
You don't really need much further follow-up. But a lot of the more complex issues, especially things like chest pain, often we're going to want a cardiologist to weigh in on that. You know, someone who's having chest pain, they're going to need further testing. We'll do lab work, EKGs, x-rays, stuff like that in the emergency department, determine, is this a heart attack right now or is it not? Because that's kind of the big defining feature. Do we need to do something right now to save this person's life and save their heart health? And then if it's not like a heart attack or something emergent, then we'll generally do further testing and refer them to a heart doctor so that they can go get further testing done on their heart to make sure that it is healthy.
Right.
We do a lot of what's called triaging, where we see patients and then we determine, is this life-threatening, is this not life-threatening, and then where is the next place for them to go? And primary care doctors do that a lot too. Primary care doctors, though, have a much bigger tool bag than the ER doctor does, you know. And so they'll refer you, if you're having trouble with your heart, to a cardiologist, or if you're having trouble with your kidneys, to a nephrologist. And so oftentimes accessing the emergency department is kind of a gateway to what are the next steps. How do we manage this right now, acutely at 2 o'clock in the morning on a Saturday night? How do we stabilize this, make sure the patient is safe? And then what are the next steps and who do they need to follow up with? Sometimes that's you're too sick to go home, you got to stay in the hospital, and now XYZ doctors are going to see you in the hospital.
Right.
Or sometimes it's you're okay enough to go home and then follow up with XYZ doctors. And I find that that's why it's so important to have primary care doc too, because that's their role is pointing people in the right direction. If it's not something that can be fixed in the office that day, they can point you in the right direction to get the answers, to get it tested further and fixed.
So have you ever, in all of your practice, seen something that is still baffled you?
Yeah, but it's mostly the personal things, like what the choices that people make.
I see. Okay.
It's not necessarily so much the diagnoses.
Right.
We've got a pretty good list of those.
Sure.
You know, they kind of beat you with a stick in med school.
Nothing's Dr. Housed you so far yet,
Yeah,
where you're like,
well,
wait a minute.
There are always those things, but we have such a good team,
Yes.
you know, that we refer to the next doc and they help figure it out. We're not practicing in a vacuum.
Right.
The thing that I always find surprising is just the choices people make. We're funny little creatures, and sometimes we do funny little things.
Yes. Okay, so probably here, well, I want to talk a little bit before I ask you this last question. Like I said, you're an ER doctor, and lots of people still. We had a great feature that we did over the Memorial Day weekend with you, where we asked these really silly questions about whether or not you go to the ER or you go to urgent care, right? And I think that was a blast having you come in and do that, because even though the questions were kind of silly, they were still questions I think that everyone can have them. So what is your take on that then as an ER doctor? What do you? I mean, it's kind of there's a list of things obviously you could talk about where you see urgent care or ER, but what do you wish people knew the most about?
Yeah, I would say like. The ones that are clearly go to the ER are, do you think you're dying?
Okay.
If you are like, this is bad, I think I might be dying. That's an ER all the way. And if it turns out that you're not dying, that's awesome.
Right.
Like, that's great. It's a great day. And I'm glad that I can reassure you that you're not. But if it's bad enough that you're like, this is real bad, that's probably an ER visit.
So you have to trust your gut a little bit, maybe?
You do. No one knows your body better than you do.
Yeah.
And if you are having some sort of symptom that is profoundly bad, it's just ER visit time.
Okay.
It's ER visit time. Often anything that has to do with chest pain or bad shortness of breath, those are ER visits. If you think you're having a heart attack or a stroke, those need to go to the ER. So if you're having numbness, weakness on one side of your body, like that's an ER visit. Early, every day, all day.
Right.
Don't call your primary care doctor's office. Don't go to the urgent care. Those types of things. Those are very clearly ER visits. And then there's everything else. And it really is so hard for patients to decide where's the appropriate place to go. people don't want to go to the ER if they don't have to. They know that the ER is for emergencies. It's for car accidents and strokes and heart attacks, and they don't want to be there unless they have to be there. And so I feel like patients oftentimes will triage themselves to a lower level, trying to be helpful to the healthcare system. And they're well-intended, but also, if it's something that you think is serious, it just needs to be seen in the ER.
Okay.
If it's routine business hours, you can always call to the doctor's office and have them help you make that decision. We see a lot of patients who call their primary care doctors if it's during business hours and say, hey, I'm having this symptom. Where should I go? Can I come see you? Can you get me in? Or should I urgent care or ER? And that is so helpful because that doctor knows them and they know their health care and they know what kind of medical problems they have. So like chest pain in a 10-year-old is a lot different than chest pain in a 60-year-old man who's had multiple heart attacks in the past, and so your primary care doctor, if they're open, is a good way to go about that. We do see a lot of people, though, they're just like, I waited until 8 o'clock in the morning on Monday to call my doctor, and then my doctor said, oh my God, go to the ER right away. And so when it's any of those like life-threatening symptoms, chest pain, shortness of breath, symptoms of a stroke, things are real bad. You just got to go to the ER, and that's what our specialty is determining, is this an emergency or not? And if it is an emergency, you're in the right place. And if it's not an emergency, we can still help you with that.
Exactly. Yeah, that's perfect. Okay, that is probably the best way you could have answered that for sure. Okay, so this last question here that somebody had written in with, I think I've got an email on this one. There are still a fair number of people that exist that don't have a relationship with a doctor. Yeah. They're scared to go to the doctor, which is understandable. But hopefully after 100 episodes of this podcast, you don't have to be anymore because we've talked to some wonderful people and various other reasons, I'm sure. But what advice would you give to someone who wants to build, that relationship with a family doctor? What would be...
You can interview a family doctor. You can go see someone and see if they're a fit for you. And if they're not a fit for you, that's okay. Not everyone is a fit for everyone. And, I always kind of talk about there are, some docs who are a little more paternalistic and this is the way it is. And they give their advice and it's less of a dynamic discussion. Some people want a doctor who is just going to tell them what to do.
Right.
And some people want a doctor that they can have a two-way discussion with and make decisions with. And so you just got to find the person that fits you. It's like dating, essentially.
You're right.
If you're going to share your deepest secrets, your personal medical secrets with someone, it should be someone that you have a good relationship with, that you can trust. And if you see someone and they're just not a good fit for you, it really is okay to try to see somebody else, and find another doctor who's a better fit for you. Sometimes that can be in the same practice. It's just like, yeah, I've seen Dr. So-and-so, but I'm kind of looking more for someone in fill in the blank, whatever you're looking more for. And the office staff can sometimes put you with another doctor in that same group and find someone who's a good fit for you.
Yeah.
It's okay if your doctor's not a good fit for you and you want to find another one, You want trust with your provider, and a lot of women want a female provider. A lot of men want a male provider.
Exactly, yes.
And so being picky and picking one that fits for you is okay. That's all right.
I think that is something people need to hear, because too often they think, well, I find a doctor, I go to him, and that's the doctor I see. The dating analogy, I think, is the best. That's probably the best thing you could have thrown.
You shouldn't date everybody, though.
No, that's just it. I mean, you gotta find your
match and stay there.
And go with that. Doctor, thank you so much for coming in and doing this. These questions were fun. And it's always fun to talk to you. This has to be a busy time of year for you, for sure, though.
It is, but it's not the busiest yet. No. We aren't to August yet. I always refer to August for an ER doctor as December for Santa Claus. August is my busy month.
And that's not an exaggeration.
No, it is not.
I mean, it just because we go from a state of 800 and some odd thousand people to a state of 1.8
We do.
whatever
we
people,
have
right?
so many people that come in,
yes.
not just for the rally, but also just for fun summer activities in our area. And so it's getting to be that busy time of the year, but it's not quite August yet.
Okay.
In August, I just kind of disappear from life.
Well, that's why you got to go get your vacation time out now. Just relax for a little bit, and then
I'm pretty much in the ER all of August.
Dr. Deanna Lassegard with Monument Health, thank you again for coming in. I really appreciate it.
Thank you for having me, especially on the anniversary. I feel very honored to be the 100th episode.
Oh, well, you'll be the 200th too. I'm just penciling you in for that right now.
Very good.
Thank you, Doctor. I appreciate it.
Thanks.